is Mental Health Awareness Month, and the theme is Turn Awareness into Action. It's challenging individuals worldwide to move beyond simply understanding mental health issues and actively engage in supporting those affected. This initiative highlights the importance of transforming awareness into tangible efforts, urging everyone to take meaningful steps to improve mental well-being within their communities. Advocates emphasize that action can start with small, impactful steps such as learning more about mental health conditions, reaching out to friends and loved ones, or supporting local mental health initiatives. These actions not only reduce stigma, but also build stronger, more compassionate networks that prioritize mental health. The movement also encourages individuals to use their voices for advocacy, pushing for policies and resources that make mental health care accessible to all. By embracing this theme, communities can work together towards a shared vision where mental health is no longer sidelined. Advocacy, education, and consistent action are at the heart of this effort, fostering a culture where seeking help is normalized and every individual feels supported. Together, we can create a world where mental health is recognized as a fundamental component of overall well-being. Our guest is Olakunbi Oyedele, Executive Director, Living Vines Mental Health Foundation. Good morning and welcome to the program.
Good morning. Thank you so much for having me.
So the basic question right now, this is the 16th day of May 2025, and the whole of this month is Mental Health Awareness Month. How far so far?
Well, we have come a little bit farther. We have come, I remember you coming to the show last year, this time around last year as well, talking about mental health. And I can say that from last year to this year, we have made some improvement. We've seen more people coming in and asking for more help when it comes to mental health. We've seen more people being less, meaning that the stigma has reduced, where people are willing to share even more about the mental health challenges. We've seen a rise in mental health services provided to people. We've seen people saying, "I need more, I need help." So there's that has grown, right? But there's also a huge need. So because we have seen more people saying that we need more help also means that there's a need for resources and more professionals to help provide the needed help. So the stigma, I think, is reducing because people are recognizing that there's need for help. There's need for, I need to be coached, I need help. There are a lot of coaches, mental health therapists out there, much more awareness about mental health. So that's good. But do we have enough resources to cater into for the people, the need of the people, and also the people that don't have the resources to get it? So those are the other things that we need to talk about. Also, do we have enough trained professionals to provide the help that is needed? There's also been a rise in suicide. In the past year, we have seen more people in the news. We've heard in the news of people die by suicide. So those are things just shows that there is a need for more to be done, but we are grateful for how far we've come.
Yeah, when you talk about manpower, trained individuals that can take up the responsibility of offering this help that is needed by these people who have asked for help, it also covers people who may not be doctors, all that, because I know that outside Nigeria, we have support groups that may not be run entirely by doctors per se. So how much are we lacking in that aspect in Nigeria, and what can we do to improve that? Because not everything should go to the hospital.
You're right. We are actually lacking in some regards. Like you said, there are some self-help groups and there are some groups here in the US, right, where people are using, people that have gone through mental health challenges and have recovered, using their experiences to provide support. They're not necessarily providing the skilled help. They are providing more support. They are peer support specialists. So that's one of the things. That's another layer that we definitely need. The need for peer recovery specialists, and also to certify. They are certified. They go through training in order to use their own life experiences to help other people, right? So that's one. There are people that we also need more therapists. There are therapists that are there, but they need more certification, right? For example, how do we know, right, that the therapist actually going through required training every year to upgrade their skills so that they have the ready, available, and upgraded training to provide needed services. So that's another area we need to look into. Right here, there are different layers and strategies for to help people with mental illness. So, for example, there's, like I said, there's the peer recovery specialists. There are the therapists. We have the social workers. We also have the psychologists. Before we now go to the psychiatrist. So there are different layers of helping people, but we need more of those people who are trained and certified to provide this help.
Okay, you said there's been an improvement of people who are seeking help. How much of this is a product of a deliberate policy from government, for instance, and not just private individuals like the organization you run?
Well, I see that the government, I really do think that the government needs to do more. Let me say that. The government, like I said, there are a lot of private organizations like mine and other organizations, non-profit and other private people who have come out to say we need help. We can provide as much help. But is the government kind of working with them to say, okay, how can we make your voice louder? And I think that's one of the pull. That's one of the things that the government needs to look into. Mental health is a big issue. Everybody, a lot of people are struggling with mental health challenges. Everybody has mental health, like I've said over and over again, but not everybody has mental health challenges. There are a lot of people that are struggling with it. And if the government doesn't step up and say, we need to make this a public health issue, and be serious about it, and then we might have a epidemic of this, and the government, and even pandemic, epidemic, and the government will have a lot of we'll have to now start working backwards to provide the help. Right now, like we said, there's a need of collaboration between organizations. The government needs to prioritize the need for mental health, especially for students, in fact, for everyone. But we can start from different collaboration efforts to come together to help people that are struggling.
Okay. Well, do you have the demographic that is mostly seeking this mental health, help for mental issues, rather? Do you have a demographic that is more prevalent when you're seeing patients or people that need help?
We definitely, to be honest with you, it's all-round help. We help all-round, but we see that what we have seen is we see more youth that are more willing to share, right? We're currently in secondary schools in Nigeria, so we see a lot of students, we see a lot of younger children saying, hey, I am going through this. Once you're able to provide the language for them, right, able to explain things to them, they can say, oh, I am actually going through this, I need help. So we are seeing more kids, we're seeing more students, we're seeing more youth saying we need help. We see more, I would say, Gen Z. Why? Because they are in the age of enlightenment. They're in the age of social media. So social media has really helped in helping people identify, project, and highlight the need for mental health services. We still see a struggle with older population, even, identifying, right? or identifying that they have, if they have had mental health challenges. We have the older people trying to, not identify the struggles, right? They maybe because of the languaging, right? I think that's another thing. One thing that we've been able to do better of in the past few years is give a language to mental health. And I feel like the younger population is able to identify with that, through pop culture, through social media, and all of that. But we definitely need more awareness for the older population who are also struggling, and for mental health services as well.
A concern I have is that the Gen Z, I was expecting that you would say Gen Z because they are the people that I've heard so much talk about mental health. You give them a job and 3 days later they're saying it's impacting on their mental health and they leave it. And so I'm wondering if there is a trigger now that leads to this mental health crisis, if you want to say that, or if there's a milder term, I don't know. But why is it so prevalent among the Gen Zs that they say everything is connected to their mental health, I don't understand. Why were the elderly people built tougher, or there's something that is triggering the new generation to always talk about mental health, whether you can see it or not?
I love the Gen Z. So I would say that, one thing that they have done is because there's, like I said, we've given them the opportunity to have a language. That is why a common language to say this is what it is that I'm feeling. And so also the awareness of the increase. Mental health challenges have always been there. This is prevalent. It's been there even years and years and years. I've spoken to people whose parents have struggled with mental health challenges, but who have been able to, because of the stigma, can't come out and share the mental health challenges that they are struggling within their families. So it's just that there was more stigma back then. If you go around, you would see that it's been prevalent. It's just like I said, the stigma, right? The shame. So what the social media has done, and the Gen Z has taken, because they're in the social media generation. They are the ones where internet has really helped to amplify their voice, and they're using that as an opportunity to speak about some of the challenges that they inquire. Of course, is there the risk of people over-identifying?
Yeah.
It's very possible, right? It's true, but it's still good that the fact that we're able to talk about it, right? We're able to. So I think what we now need to do is to talk more about the myths, talk more about the facts, so that people understand what mental health is and what mental health is not. Is every day people sometimes identify stress, everyday stress, which could lead to mental health challenges, as some of the things that they're struggling with. So, like I said, the language, what they have done is use the language to really amplify the need for mental health services.
Yes, because I was concerned about over-identifying, like you said, because everything is just tied to mental health. We need to know there are some things, maybe if it's just laziness, there could also be mental laziness that will give some people the room to just say they are suffering mental health problems because of X, Y, Z. People need to be resilient in some ways and all that. But as we wrap up, what is the way forward as it is? When we're talking awareness of mental health issues in the month of May, what are the critical areas that we should be addressing as we go along?
We definitely need to continue talking about the need for mental health services. We need to continue to push, because the more we talk about it, hopefully the need for the government, the more the government understands the need and the impact of what it is that's going to be done. So we definitely need to do that. We need more. For example, one of the things my organization is doing is we're providing a 24-hour hotline. So other awareness where people can come in there and share and just connect, right? Providing services to people. So that is, what we're trying to support, to provide the need for people to come and provide services, access to services. Those are some things. We also need, like I said, we need to do more of a public health campaign. We need to do, and that needs to start from the top. Sometimes, as mental health, as advocates, it might look like you're doing so much, and your voice you might not have as much impact as when you get a bigger audience, or you get the government to say, okay, let's all these people, all the NGOs come together and let's amplify the voice. So we definitely need the government to say, okay, let us, as we're this month, let's shine the light, let people that are involved come in and talk about it more. We definitely need more training. So action requires more training. We need certifications to go around. We need people to be certified. We need people to be trained so that people can provide the appropriate services to the people that need it, right? We need coaches that are certified. We need therapists that are certified. We need psychiatrists. There's a need for that. We need also mental health centers to be provided. Maybe in addition to the health centers that are already provided, we need people that are situated in the centers to provide the mental health need. We need crisis centers. We need a hotline. The government needs to do that, where people can actually call in and say, hey, a general number, right, where people can call in and say, hey, and there's a crisis going on, I need help. So we need the government to step in, and definitely to improve and increase the impact of the work that we're doing. So that really, those are some of the things that we need. And we also need, like we said, more training for even school counselors to be trained, because there are some of the children in schools that are suffering from mental health challenges and going to school every day. And we need counselors in schools. We need parents to understand how to help their children improve their resilience, improve their coping skills. So there's a lot of training that needs to be done. We are getting there. We're doing more than we have done before, but there are some steps that we need to take to just increase the impact of what we've done.
Okay, well, we hope that that impact will be felt everywhere, and the stigma will go down even more than it has gone now. And we hope that the government will be deliberate about it, because everybody, even those in government, need a clear mind to function the way they should function. And it's a good thing. Well, we'd like to thank you for coming on the program this morning. It's always a pleasure having you. Go there, capture the people, capture the minds of the people, and let sanity be the watchword in our society. Thank you so much for your time.
Thank you for having me.
Yeah. We've been talking with Olakunbi Oyedele, Executive Director, Living Vines Mental Health Foundation, and we were looking at mental health issues. This is the month of mental health and how to translate that into actions. We'll take a short break, and when we return, it will be women empowerment. Stay with us.